We're going to talk about subcutaneous pacing emergently. So a patient who has symptomatic bradycardia, especially a patient who has had like a recent MI, like an inferior MI, complete heart block, unstable, second degree type 2 unstable. So in those certain circumstances, we would need to subcutaneously pace the patient. So one of the things you need to make sure you need to do is clear the skin. If you have somebody who has a lot of chest hair, you do need to make sure that you shave the chest because you do need good adherence to the skin with these patches. So once you shave the skin, you're going to place the patches, and you do need to make sure that the patches are placed how they are on the pictures. So you're going to place them anterior and lateral. Then you're going to take the 3 leads. I have them on my simulator right now, but you do need to make sure you have the 3 leads also placed on your patient. If the patient's symptomatic, they might be very diaphoretic. So getting tegaderms and making sure those are on the skin and adhered well, that isn't going to be important, because your 3 leads are going to sense and your defibrillator patches are going to pace your patient. So once you have that set up, you're going to turn on your monitor.
Push analyze.
And as you can see, our patient is in a second degree type 2 rhythm. So what we would first need to do is we're going to turn on the pacer. It automatically defaults to a rate of 60, and we're going to take the current and we're going to start turning it up. Starts at 0 and it goes by 10, 20, 30. If your patient is very thin, 50 is probably a good current, but if you have a heavier patient, you are going to need to go up pretty high on your current to make sure that you get capture. So a capture is going to be a pacer spike with a wide QRS. As you can see here, I can see pacer spikes, but this is not capturing. Okay, so I'm going to keep going up on my current till I get a pacer spike with a wide QRS. So as you can see here, it changed. So I have a pacer spike, wide QRS, pacer spike, wide QRS. This means that we have started capturing our patient. So you want to go back down. Here I lost capture. Back up to 100. I have capture. Then I'm going to go up about 10 to 20 just for safety reasons, just for a safety margin for your patient. You also want to make sure that you check a mechanical pulse. You want to make sure you check your patient's pulse. Do they have a pulse? If they don't, what do we need to do? We need to start CPR right away. So if for some reason you're not able to get a good pacer spike, wide QRS, not good capture, maybe you need to readjust the leads, make sure that they're adhering well to the skin. And always, if you lose a pulse, CPR. Okay, those are the things that you need to remember when you're doing emergent pacing. You can also press pause here, and it's going to show you the patient's underlying rhythm. Once I go off of it, I'm going to get capture again.